Hunger is the need for food, and appetite is the attitude to food. Hunger is unconditional. One can feel hungry at any time, day, night, in activity or sleep. But appetite is conditional. One can be tempted or trained to have an appetite. One cannot become overweight when eating for hunger. So kung gutom, kakain tayo pero hindi ito nagkakos ng overweight. But one can gain weight when eating for appetite because such people do not recognize when to stop eating. So yun pa yung difference. Treatment episode 4 of hypoglycemia. The treatment principle is to slow down the speed of emptying of stomach, sedate the yang, and to make the food stay a longer time in the stomach, we tonify the yin. So sa tower diagram, there is an excess yang in which the yin deficiency, representing yin deficiency and hyperactive yang. So the points we use is REN 12, which is the mu front of the stomach 43, the wood point, the grandmother point, which tonifies the yin, and we use spleen 21, the major Lu connecting point, sedate the stomach 42, the yuan source point, which tonifies the yin and sedates yang of the spleen and stomach. Eat more protein and milk products. Avoid refined carbohydrates. Next, we go to treatment against overeating. Here we need to improve the emptying function of the stomach. We tonify the qi and thereby eliminating retention of food. So sa tower diagram, the stomach, there is fullness and retention of qi deficiency. We use the point REN 12, we moxa only, to be given daily for weeks, 3 times weekly from then on, 20 minutes before the main meal. This is to increase heat and function of the stomach. Next, we use stomach 40, which is the Lu connecting point. Spleen 9, which is the water point of spleen, eliminates fluid, reduces absorption. UB20, UB21, which is the Bakshu point of the spleen and stomach, improves function. Eat whole meal and unrefined carbohydrates and avoid fats. Eat a light evening meal early. Generally, we tend to feel more thirsty when we are active or warm or when it is dry outside. When we are cold or when the weather is humid, we tend to be less thirsty. It is also quite normal to have a dry throat if one laughs a lot and loudly like a teacher, or at night if one tends to breathe through the mouth during sleep. In all other situations, excessive thirst means there's a need for fluid, yin deficiency. This could be a kidney yin deficiency, or it could be a dry heat symptom in the respiratory system. It could also be dryness in stomach with cold or heat. When thirst is a symptom of the stomach, also ask the patient about their preference for hot or cold drinks. A cold stomach, yin dominant state, ask for boiling hot drinks, while a hot stomach, yang dominant state, prefers cold drinks. A hypersensitive stomach, yin deficiency with yang excess, is sensitive to all and can only tolerate moderate temperatures and no fizzy drinks. And a yang deficient stomach is not sensitive and likes only extreme temperatures and fizzy or burning drinks. Hunger and thirst are governed by the same factors and therefore should be present or absent simultaneously. But if a patient confuses hunger with appetite, in which case they may say that they forget to drink but are very hungry, or that they are often thirsty but not hungry. If this happens, then we should consider thirst as a symptom that is more important for diagnosis and ignore the hunger.